Hello, my name is Dr. Lei Chu. I'm a board certified urologist in West Houston. Today, I'd like to talk to you about a topic personal to me, and that is infertility. Contrary to popular beliefs, not all infertility comes from female factors. In fact, 40% of infertility come from female factors, 40% come from male factors, and 20% come from both male and female factors. My husband and I have struggled with infertility, and by the grace of God, we have two beautiful children. If you are struggling with infertility, I hope this video can help you along your journey. So, first of all, how would you know if you have fertility issues? Fertility is affected by age. If you're a woman in your 20s and have regular menstrual cycle, and have regular intercourse around ovulation periods, you should have about 80% chance of getting pregnant within 6 months. In contrast, if in your 30s, the chance of pregnancy within 6 months with regular menstrual cycle and regular intercourse around ovulation period is about 70%. For women in their 40s, this chance goes down to 40 to 50%. So what impacts male infertility? Things like smoking, marijuana use, anabolic steroids to build muscles, long-term cycling, that means more than 5 hours a week of bicycling is associated with lower testosterone and poor sperm count. Genetic factors such as Klinefelters, Y chromosome deletions, and family history of male infertility. In my experience, genetic factors are more rare. If you have infertility issues, you should go visit a urologist. Low morphology is one of the most common things we find on abnormal semen analysis. This is also the most difficult to treat. As urologists, we do not know the exact reason for why morphology will be low. Morphology means the shape of the sperm, especially in the head. If the head of the sperm does not have correct shape, does not have correct proteins to get into the egg, therefore cannot have fertilization to occur. We think that low morphology comes from chronic inflammation in the body. What are the things that can lead to chronic inflammation? Stress, smoking, marijuana use, lack of sleep, lack of regular exercises, poor diet. So for patients with low morphology, what I usually recommend first are supplements. The supplements I recommend are ubiquinol, which is a higher concentration and easily absorbable form of CoQ10. Ubiquinol, 200 milligrams daily. Vitamin C, 1,000 milligrams daily. This is higher than what's in the multivitamin. And vitamin E, 400 international units per day. Every man with male infertility, I recommend a vitamin D check. If it's less than 50, we supplement with vitamin D over the counter. Almost everyone in Houston have low vitamin D because it is very warm outside and we get vitamin D most likely from sunshine. Another thing I recommend for low morphology, diet changes. Studies have shown high meat intake leads to lower testosterone and lower sperm count. Therefore, I recommend most of my patients with male factor infertility to reduce intake of beef and chicken and coffee and alcohol. If possible, to cut chicken and beef completely. Proteins can come from other sources such as avocado, tofu, wild-caught fish. Please note farm fish is not recommended. And also organic chicken, organic eggs are good sources of protein. And in addition, nuts are excellent sources of protein. When you see a urologist, first of all, a physical exam. On exam, I am looking for varicocele. Varicocele are dilated veins in the scrotum, especially on the left side. 15% of men have varicocele. So not all men with varicocele have male factor infertility. Varicoceles can increase the temperature of the testicle, therefore reduce testosterone and reduce sperm count. I'm also looking for testicular size and whether the testicular size is symmetrical. I'm also looking for masses in the testicle. Another workup include blood work. It is important to do lab work in the morning before 10 o'clock. You do not have to fast. The reason why is many of the hormones we're checking in the lab work goes down after 11 in the morning. We're checking for testosterone, estrogen, and pituitary hormones and thyroid hormones. Pituitary is a small gland in the middle of our brain that regulates and controls the hormone production in the rest of your body. We're evaluating for FSH, follicular stimulating hormone, LH, luteinizing hormone, and prolactin. Another part of the male infertility workup include semen analysis. I ask most of my patients to do semen analysis within 3 to 4 days from the last time they ejaculated. That means more than 3 days, but less than 5 days. We're looking for concentration, motility, forward progression, morphology. Concentration just means how much sperms you have. We're also looking for volume and pH. Volume and pH can distinguish between obstructive versus non-obstructive azoospermia. Azoospermia means very low sperm count. On the semen analysis, the most common abnormality we see is morphology. Low morphology is very common to find in semen analysis, but also most difficult to treat. We, as urologists, do not know what causes low morphology. Thank you for watching this brief introduction video on male infertility. I would like to share with you about a book I have written a few years ago detailing more in-depth information on male infertility along with our personal struggles through IVF. This book contains workup, treatment, evaluation on male infertility, along with stimulation protocol tips and embryo transfer tips involving IVF. I hope this book can serve as a resource to help you through your infertility journey. Thank you for your attention.